It doesn't matter how good your pain tolerance is, a headache can shut you down. It can ruin your day. And one of the most common headaches that we see in our office is a cervicogenic headache, also known as a tension headache. And if you fit this category of people, you get tension headaches, I've got some really good news for you. We're going to be going through the best treatment options for your tension headache. Hi, I'm Dr. Clay Sankey, chiropractor and owner of TruMotion Therapy here in Charlotte, where we specialize in the conservative management of musculoskeletal conditions. That's treatment without the use of drugs or surgery. And today we are talking headaches. Cervicogenic headaches, also called tension headaches, one of the more common causes of headaches out there, hitting about 20% of people with headaches. And it's caused by tension or some kind of stiffness in the neck. So if we look at the anatomy of the neck, obviously we have the spinal column, which has joints and intervertebral discs in between. If we get tension here, it can lead to pain that's referred into the head. We also have a ton of muscles in the neck. Muscle tightness in the neck will also cause pain that goes into the head. If we look even deeper into this, we also see these little yellow things that run through here. These are nerves. Tons of nerves in the neck, and some of them even go up into the cranium as well. And if we get tension or inflammation around these muscles, it can affect the nerves and cause pain that again gets referred into the head. Now, a muscle doesn't just have to start in the neck and go up into the skull to create tension there. We can get something called referred pain. So that is pain that is felt somewhere distant to the actual source of that pain. And one common cause of this is trigger point pain referral. So a trigger point is a taut band of muscle fibers that lives within a muscle and causes pain in a very particular pattern. So one of the more common causes that we see as it relates to tension headaches is in a muscle called the upper trapezius muscle. We can get trigger points, or these taut muscle fibers or muscle knots, that then cause pain in this pattern right here. And you can have pain just in this red spot here, or just behind the ear, or on one side right behind the eye as well. So, or even into the jaw too. So these trigger points can be kind of confusing because it's like, man, I feel pain in my head. Well, no, the actual issue is in your neck, even if you don't have pain in your neck. So how do these muscles or joints become tight in the first place? Well, they become tight just due to our normal everyday activities and habits, the way we hold ourselves, our postures, any kind of stress from athletic movements or exercising. There's a number of different things that can cause these muscles to become tight. And what we need to do is we need to work on addressing the cause, why they're becoming tight, and then we need to actually get them loosened up so they're moving freely, not causing pain, not causing headaches. So how do we do that? Well, one of the first things that people do when they start to feel a headache coming on, gosh, myself included, is they reach for the medicine cabinet. They want to knock that headache out because it's so painful. And now, some medication can be beneficial in the short term for headaches, but you're really not addressing the cause, especially if you're dealing with a tension headache. If that tension or that headache is coming from issues in the neck, you're really not getting to it with a pill. So we need to make sure we're addressing tension in the neck. And the best way that we can do that is by mobilizing the joints in the neck. That is through some sort of spinal manipulation. That can be a classic adjustment that we get from a chiropractor, or some gentle mobilizations that we can do as well if you're not a good candidate for a traditional manipulation. We also want to work on the soft tissues in the neck. We can do this with some massage, but if that's not quite getting to it, dry needling is a fantastic option that has been proven in the research to be a great option for those dealing with headaches. Dry needling creates a small little trauma into the muscle to help stimulate blood flow into the area, help relax the muscle, and it has an analgesic effect as well. The combination of spinal manipulation, dry needling, needling, some exercise, and then modifying some lifestyle factors not only takes care of the pain that we're experiencing in the moment, but can help prevent headaches moving forward into the future as well, which is really what we want to do. Nobody wants a headache. We want to get rid of it and keep them away. So if you're dealing with headaches, if this is something that you've struggled with before, we would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or to book an appointment.